Good morning, everyone. It's David Porter, and I am here today to talk about opiates. I want to give a quick overview of opiates. Opiates are drugs that are derived from opium. Opium comes from the opium poppy. Opium poppies are primarily grown in Afghanistan, also Vietnam, Cambodia, Laos, Burma, Thailand, and China. In these regions, you will have fields of poppies, red, yellow, orange poppies, as far as the eye can see. These are opium poppies. The bulbs of the flowers will be scored by workers, and a sap will ooze out, which will dry in the sun, and the sap is going to be collected. This sap is raw opium. Skilled chemists, most often operating under the auspice of Chinese triads, which are Chinese organized crime syndicates, will process the opium, extracting morphine from it. The morphine is going to be converted into heroin, specifically what's called China White, which is an extremely pure form of heroin, up to 99% pure. The very pure heroin is going to be cut or diluted with or stepped on. Those terms all are synonymous with non-psychoactive inert ingredients, and that's going to include things like mannitol, which is a baby laxative, confectionery sugar, baking soda, baking powder, and strychnine. Basically, any white water-soluble powder can be used to cut heroin, and this is to increase the weight and the volume to maximize profits for the dealers. The cut heroin is going to be transported to Australia, North America, Europe, where dealers will cut it further with more inert ingredients, or as I spoke about in another video, with psychoactive ingredients like fentanyl or carfentanil to increase the potency and maximize the weight and the volume to maximize profits. The heroin is then distributed. By the time it reaches the user, it's going to be probably single-digit purity, but still very strong enough to get high on or overdose on. It's widely said that the closer you live to a coastline, the stronger heroin you can get. Now, heroin can be used intravenously. That's the most common and best known method. It can be injected directly into a vein. It can be snorted or insulfated up your nose so that it gets absorbed in the mucous membranes of your nose, and it can also be smoked. The user can get heroin into their body in a number of ways. Now, heroin will produce a very strong sensation the first time it's used. It will produce a feeling like an orgasm through every inch of your body, from the top of your head to the tips of your toes. And that's going to be followed by 4 to 6 hours of a very warm, sleepy, relaxed kind of feeling where the user will be in and out of consciousness. It's a very pleasant feeling which people learn to crave very quickly. Some of the other effects of heroin are going to be, and all the other opiates, are going to be analgesia and euphoria. Those are the two main effects of opiates. You're going to have relief from pain, and you're going to have a very, again, warm, sleepy, drowsy, relaxed feeling. If you look at someone who's used heroin, they're going to be doing this stuff. It's called nodding. Their eyes are going to close, their head is going to droop, and then they're going to wake up with a start, in and out of consciousness. If you look at their eyes, their pupils are going to be pinned. Their pupils are going to be much smaller than normal for the amount of ambient light. And they're probably going to be flushed. Their face is going to be red, and they're going to be very lethargic. It's going to last, again, for 4 to 6 hours, and when someone comes down, very often the first thing they want is more heroin. But your body has already adapted. you are going to have some tolerance. Tolerance is going to build very quickly. When heroin is used regularly, tolerance can build within a matter of weeks. That means the user is going to need to use a larger dose of heroin in order to get the same high. But that's going to cause more adaptation and tolerance, which means it's not going to be quite as good, so they're going to use more. And this cycle is going to repeat itself where one can become physically or physiologically dependent within a matter of weeks. And there's also a very powerful psychological dependence. There's both a physical and psychological need to consume more and more opiates. Now, once a person has reached a point of physiological dependence, things are going to get very bad about 12 to 18 hours after their last dose of heroin. If they don't continue dosing repeatedly, they're going to experience numerous very uncomfortable withdrawal effects, which can persist up to a week. Their eyes are going to water. It's going to start slowly. Your eyes will water, eyes will start tearing, nose is going to start running, and then you're going to get nausea. You're going to get a queasiness, which is going to progress to severe nausea and vomiting and stomach cramps and diarrhea, profuse sweating. You're going to sweat so much at room temperature. You're going to sweat right through your clothes. You are going to be dry heaving after you empty your stomach out. Very bad pain in your joints and muscles. You're going to get a mouthful of what feels like a mouthful of toothaches, a splitting headache, fever, delirium. It's going to be one of the most agonizing experiences a human being can go through. And here's all you have to do to make it go away. Shoot up more heroin. While the user is prepping the shot, mixing the powder with water, cooking it in a spoon, tying off their arm, drawing it into a hypo, even just the act of cooking up the heroin, these symptoms are going to start to subside. By the time they put the needle in their arm and the plunger is even halfway down, all these symptoms are going to melt away, and it's going to be like you've never been sick. This is the hell that opiate addicts put themselves into. Opiates are also very, very easy to overdose on. You can experience respiratory depression. You're going to take these short, shallow breaths that will not inflate your lungs properly. Your heart rate is going to slow down. You're going to slip into unconsciousness. Your breathing is going to become slower and slower. Your heart rate gets slower and slower until you go into respiratory failure and cardiac arrest and expire. You die. And the long-term effects of using heroin, ironically, opiates do not harm your body unless they kill you from overdose in the long term. It is all of the related activities that are so harmful. Sticking a dirty needle in your body is on your unsterilized skin is a very bad idea. You're going to get infections and abscesses, or an abscess is a severe pocket of infection that you're going to get at the injection site. If you shoot up with a dirty medium, that is unsterile water, and even from the faucet, that water from the faucet is not clean enough. Tap water is not clean enough to shoot up with. It has enough microorganisms in it where if you inject the water, they're going to multiply. You can get fatal heart infections, myocarditis and pericarditis. And of course, if someone has HIV or hepatitis and they share a needle or a tutor, that is a little section of a straw that's put up the nose to snort the drugs, you can get HIV or hepatitis and spread it. So there are multiple risks involved with sticking a needle in your body to shoot up heroin. You should not be sticking a needle in your body unless you are trained to do so. Unless you are a physician, nurse, phlebotomist, or paramedic, you should not be trying to do venipuncture, puncturing a vein. Very bad things can happen. So that wraps up part one, an overview of heroin and other opiates. Please check back again for part two, which is an overview of treatment of opiate addiction. Thanks for watching. Please hit subscribe, and everyone stay safe. Now, that's something I need to remember to do, make eye contact with the camera. Okay, not in a creepy way, Just make eye contact. Okay, and ready? Thanks for watching. 3, 2, 1.